Hi, 90, what, 2 hours, 4 days post-op bilateral CMC arthroplasty. It's been pretty uneventful. Back in February, when I decided I needed to see a hand surgeon because my hands were so painful in this area, right around the wrist and thumb area. And I had no strength, I couldn't turn anything, I was like in agony. I had it x-rayed and they said that my cartilage between my bones between my wrist and my thumb were worn down. The cartilage was worn down, it was bone on bone. They offered me an injection, a steroid injection, physical therapy, braces, well, not braces, but yeah, little splints, I guess you'd call them. And I reluctantly said, maybe I'd like it fixed. How about, instead of putting a Band-Aid on the problem, let's get rid of the problem. So he said, well, we can do surgery. So I said, oh God. I asked him if he could do 2 at a time, and he said, no, he would only do 1. And I told him about my bunion surgery where I did 2, and most doctors won't allow that either. But I found one that did. It was very successful. I have a pretty high tolerance to pain. Pain doesn't usually bother me very much. It has to be excruciating for long periods of time for me to have real pain. So I was going to do it with him because he was a specialist that I've had experience with before. He does all the Patriots players, all the Bruins players, Red Sox players. It's like a museum going into his office. There's pictures of every athlete you can possibly think in the Massachusetts area. As you can see, I live on the Cape, Mashpee, Cape Cod. We have great surgeons, doctors all over Massachusetts. However, not easy to find on the Cape a hand specialist. So my girlfriend works for another hand surgeon, and I told her I was getting my hands done, and I asked her, I said he was going to only do 1, but I would have preferred 2. So I asked her if she'd ask her hand surgeon if he would do 2. And he said, surprisingly, the only other person that I've done 2 at a time was another nurse, and I'm a nurse. So he said he would. So I went in, was evaluated, and come July 26th, I wanted to wait. Who wants to do it, in the winter? Take the summer off, right? What do they call that? So I took July 26th as a date to go in. And I called him 2 days before because I'm like panicking now. I've had 2 months, 3 months of no pain. I was taking off IV pumps with my hands, which they're pretty heavy. If anybody's ever lifted one, they're really heavy and awkward to hold. I twisted it off first, and I was holding them no problem with either hand. Didn't bother me. Pushing patients around in beds, doing everything I could possibly think, and trying to make it hurt, and it wouldn't hurt. I'm like, this is crazy. They say, don't get it done if you don't have pain. However, I knew I was bone on bone, so I figured I really needed to get it done. I didn't want to wait until I got much older. I'm already going to be 65 next month. Senior citizen, here I come. So I didn't want to be really old. Not that, at one point, 65 was really old. Now it doesn't seem so old. So I figured I better do it when I'm younger and healthier rather than wait when I'm not feeling as well. I'm older, and it might be, a little more complicated to heal. Recovery might have been worse, I figured I would be putting bone on bone all that time, and it's going to just make the bone that's going to stay in there worse. So let's get it done while the bones aren't too bad. So what they did was they took a bone out, and he doesn't do the ligament one, nor does he do any prosthetic devices inside. No metal in there. There is I believe what he said was a button. So I think what it does is it stabilizes the thumb to a bone and holds the thumb up until there's scar tissue that builds up in that space. And the recovery is supposed to be faster, 4 to 6 weeks. I did take 8 weeks off, so I can get 8 weeks. However, I don't want to use all my time, so I'm hopefully going to go back in maybe 4 or 5 weeks. It's the summer. Could be a little tricky deciding. But I'm a nurse. I have to do CPR. I have to do IVs. I have to move patients, lift patients, move beds. It gets pretty heavy. And they can get feisty, so we have to hold them down. And, it can be really tricky. So I may not go right back. And if I do, I won't be doing certain things, I'm sure. So basically, the big things when I got home was to worry about the pain and infection, feeling sick, or short of breath, any blood clots. You don't want to worry. You want to be careful because you can get a blood clot after surgery. I got some bruising. Believe it or not, that's getting better. It's now turning yellow, so it is getting better. But that was just day one is the only day I really got bruising. It never got worse. It's starting to come out more, so it looks worse now. I have a little in here that maybe was day two. I thought my fingers were getting bruised, but they don't look so bruised anymore, so I don't know. I've always been able to move my fingers. They didn't give me nerve blocks. They were only going to do one nerve block, and I said, well, if you're only going to do one, why do I need another? If one arm can do it without a nerve block, why not two? Why take a risk in getting a nerve block and causing nerve damage? He said it's very minimal risk. It gives you pain recovery for 8 to 30 hours or something like that, but you can't move it very well, and it can cause tingling, which I had in my feet when I had the nerve blocks for my bunions. So I didn't want that feeling. I figured if I have to deal with pain in one hand, it wouldn't matter to deal with pain in two hands. I refused the Tylenol they wanted to give me before I went into surgery while I was in pre-op. So we decided not to do either no block. He said I could do a block after the fact. So after the surgery, when I come out, if I had a lot of pain. However, I came out of surgery and I was literally, when I woke up, she kicked me out of there. I didn't even have time to think about pain, but I did say to her, listen, why don't we have an oxycodone for my ride home? I don't want to worry about having any pain. She gave me oxycodone. I had a local, I think they call it anesthesia in my arms and down low. So that probably lingered a little longer. So that probably helped my pain too. They gave me gas and propofol for anesthesia. They put me out with that. I wasn't knocked out completely. I was breathing on my own, no tubes in my mouth. The procedure was about an hour and a half, they told me. I went in at 7, I believe. It was the 6:45 OR scheduled time. I went in, I believe, around 7. Must have started 5 minutes, if that, after that. And I was out at 10:15, and she literally, the minute I woke up, had me getting dressed. I barely remember getting dressed. I don't know. And then she stuck me in the wheelchair and wheeled me out. That was the only bad thing I have about the whole thing. The rest was unbelievable. The doctors and nurses were all wonderful. She was nice, but I felt really rushed. Like I probably was sleeping longer than she wanted me to sleep, or because the procedure took longer or something. I don't know. But she was in a rush to get me the hell out of there. So I get dressed. I couldn't snap my bra, so needless to say, it was all twisted when I got home. She did snap it for me. I was able to get it on. I was shocked they let me dress myself right out of it. But you know what? I probably wasn't having any pain. It's probably pretty well stabilized with the sutures. I had sutures on the side. How can I show you this? This side of my thumb and right on the top. A small one on the top and a longer one on the side of the thumb. I haven't seen them yet, obviously. Going Tuesday, which will be 6 days after the procedure. Yep, 6 days after the procedure. And they're going to take the sutures out and take these wraps off and put on splints that I can take off. And hopefully that means I'll be able to shower without wearing those stupid plastic gloves so that I don't get my wound wet. And I have been taking a shower, thank God. I just had my hair blow dried today, so I look a little more human today than the other videos I posted. I'm doing an awful lot, which I was really afraid to do a lot. Like, I'm really hoping I didn't do any damage and it's not going to make my recovery longer. I feel like it's going to be quicker because I move pretty well. My strength is getting stronger. I can lift more things without feeling the pain. I've been driving. I did quite a bit of driving today, local, but you know, from one restaurant to the hair salon, to the nail salon, to the mall. I had a great day today. I had some depression, I would call it. It probably wasn't depression, post-anesthesia type of sadness, whatever. I really have never experienced sadness from anything, but I have a lot of stuff going on in my life, so that could be it. But today, I don't have any of that, so I don't know if it is the stress of my life or was that the gas in propofol just made me feel like sad. I had no sleepiness from it. I think my recovery sleepiness, the first 2 days, like I was a little tired and I could sleep a lot. I wasn't tired, but I could sleep, so I did. I had nothing else I could do, I shouldn't have been doing anyways. So I thought of that as, just because, you go through recovery, your body's going through a lot of things, you got a big wound, they took out a bone. I can't believe I forgot to ask. I forgot to ask them if I could have those bones. Oh, well. What am I going to do with them? Add it to the other junk I have in this house. It's ridiculous. I have enough stuff in here. But I wanted it. Well, next time maybe. No, there can't be a next one. Hopefully it's gone. And supposedly the pain will be, minimal. I've had 1 oxycodone in 4 days. And I took 1 Motrin just because I thought, well, maybe it's getting a little more painful. I did a lot. And that's all I've taken. I went to the beach one day. I've driven now 3 days, I believe. 3 days, yeah. Went out to eat. I went to the beach twice, actually. I went out to breakfast with my grandkids. They were over here. It's been a lot. I could enjoy retirement. Now I know what it must feel like. It'd be really great if I could. What else? Let's see. I've had friends checking in on me, coming up, helping me with different things. Like my door, I can't turn the knob on the door. So I can't open my door and close my door all the way. So I leave it just a little bit ajar. I can't rip sweet and lows. I've figured out if I put it between these 2 fingers, I can rip it with my teeth pretty good, at least to get a little thing off. I couldn't open the milk on my coffee, the creamer for my coffee. I made a big pot of coffee and I can't lift the coffee pot out. I can lift it out like this, but I can't really turn it to pour it. So I just put a straw in it. I went out and got coffee a couple of days, went to church. I put the straw in my coffee, that's the only way I could do it, because it's holding it good like this, but when you turn it up, now you're talking, your thumbs are involved, so it was kind of difficult. I just can't get over the pain. It's very, very little pain. I started wearing rubber-soled flip-flops. It's the summer, but I probably should be wearing sneakers, which would be difficult to get on completely. So I've been wearing the flip-flops and just being very careful not to fall, not to slip, walking very slowly. I would never be able to grab anything. If I go down, I'm going to have to keep my hands up and pray to God. What's the first thing you do when you go down? Your hands break, you fall. So, I should be walking around with a helmet probably. God, I know I got plenty of motorcycle helmets. I should be wearing them for something. I hate letting them sit in there. Maybe next year I'll be riding a motorcycle again. Oh, I hope so. I miss that so much. Knitting too, I knit a lot. So they tell me I'll be able to do everything after this. There's people that go back to being bricklayers. What else? There's another woman went back. She knits all the time. Has no problem after that. I did go shopping, and I was like, oh shoot, I'm not going to buy anything because I can't carry a bag. However, I figured it out. Put it up here, way up. It didn't really put any pressure down here at all. So it was fine, no problem at all. Got myself a pair of sneakers that I can't wear yet anyways. What else? Eating has been a challenge in the house. I really can't cook because lifting things is a problem. So I had a lot of finger things sitting around that I could just eat with my 2 fingers. These 3 fingers are these are the ones that I work the most with, especially these 2. Sometimes I use the pointer to scoop and the other one grabs. And so that's helped me out a bit. Especially when I drop like a pill or something, I can scoop it up and then somehow get it like that, because you can't use that pinch. You just can't. The thumb is much more painful when you move that. The rest of the fingers are doing really well, so I'm hoping my rehab's going to go very well. What else? Sleeping hasn't been a problem. I don't wake up and bump it or anything and say, oh no, you know, I turned the wrong way. It's been fine. I sleep alone though, so I mean, I guess if you're sleeping with somebody, you got to be careful they don't bump you. There has been a couple of problems where I ran into people and, oh, huggy, huggy, oh, you know, hit me in the hand or something. It wasn't the kids that did that, it was an adult. Let's see. Driving, just very slowly turning. I couldn't put a buckle on, safety belt. Couldn't do that because I can't push it in. I could, I guess, I did it once and I was able to use the middle two fingers on day 3. Was that the first day I drove? Yeah, 3 or 2. But I could get it off with the middle 2 fingers today. So I was able to buckle today. And I had a little cramp in my left calf. So I was a little concerned that it could be a clot. Paid attention to it, went away. Maybe it was just the way I was sitting or whatever. Trying to drink more fluid. Not that I think that's a big deal. I'm taking my Airborne twice a day. I believe Airborne helps so much. That's the zinc in it. If I was going to get sick, cold, flu, COVID, whatever, I believe that it's going to help me. And I haven't gotten COVID. I did get the COVID vaccine, but I had a horrible reaction to the second one, so I have a permanent disease now, which is under control, but it is permanent. And it's just been great knowing, you know, friends are there, family's there, and it is totally possible to do 2 at one time. There are people that run around, they don't have any hands at all. So I figured if they can do it, I can figure out how to do it. I mean, they're not in any pain, most likely, and they're not recovering from a wound that you have to take care of or it's not going to recover right. So, I mean, that's another issue. So I figured if they could do it, I could do it. A week is all I'm really going to need, it looks like, should have been good. I just can't do it. Can't sit around. Drove me crazy. And so I did more than I probably should have. I feel fine. The sadness is gone. And hopefully on Tuesday, 6 days later, I will start rehab and I'll get my splints. I'll be able to take a decent shower. Still not going to probably be able to do my hair. I can't imagine I'm going to be able to use a brush to do it the way I like it. I mean, I could probably blow dry it. I just won't be able to straighten it like I like it. They told me I could go to the salon if I wash my own hair and they'll blow dry it. I don't know if it's going to be cheaper, but they did charge me for conditioner, which I thought was weird. Pro Cut, supposed to be cheap, cost me $47 with tip. I mean, I couldn't find another one that was open. She did a great job. And hopefully it'll look good again tomorrow because I can't afford to do that every day, which I like to wash my hair every day, but I can't do it. I can't blow dry it every day right now. And I'll get back to you after I have some rehab and some splints on and let you know how it's going. I'll take some pictures of the wound, the splints, some rehab, and I do have some Facebook pictures. I'm gonna put it on my Facebook page. It's open to the public right now, so if you want to check it out, it is Annie Kelleher, ANNIE-KELLIHER, and you can see some nice pictures on there. I'll leave the videos to YouTube though. All right, take care. Good luck. I hope you have just as much success as I do, and hopefully I continue to have success because this is amazing. The pain is very minimal. Mostly when I move too much or pull something, I'm lifting things too, which I think is weird, but hopefully I'm not doing anything wrong. All right, you have a great day. Bye.